Pharmacology is the number one reason nursing students fail the NCLEX. Not because you didn't study, but because NCLEX pharm questions don't test memorization, they test thinking. You don't need to memorize every drug. What you need is a strategy, and that's exactly what we're covering today. Welcome back to Katie Closet, where we study smarter. In this video, I'm breaking down 3-step strategy that help you tackle any NCLEX pharmacology questions, even ones about drugs you've never seen or heard of before. So let's get into it. Step 1, read the drug suffix. NCLEX loves giving you a drug you've never heard of. But here's the secret. The ending of the drug name tells you exactly what class it belongs to, and that tells you everything you need to know. If it ends in olol, it is a beta blocker. Think metoprolol, atenolol. You already know the side effects of these medications, such as bradycardia, hypotension, and the key fact to know about beta blockers is that you never stop it abruptly. If it ends in pril, it's an ACE inhibitor, such as lisinopril, enalapril. You want to watch out for dry cough and hyperkalemia with these medications. Statins means it's for cholesterol, such as atorvastatin or simvastatin. You want to monitor for liver enzymes. Azole is an antifungal, such as fluconazole. You watch out for drug interactions. And psyllin, such as amoxicillin. You watch for allergic reactions. So you don't need to memorize every drug on the market. It's nearly impossible to do that. You need to recognize the suffix, identify the class, and apply what you know about that class. Step 2, find the priority word in the question. NCLEX pharm questions are almost always going to ask you to do one of 4 things. They want you to hold your medication, monitor for something, teach a patient, or assess before giving. These are your 4 priority words, and whichever one appears in the question tells you exactly what kind of answer you're looking for. If it says the nurse should hold the medication when, you're looking for a contraindication, a vital sign that's too low, a lab value that is out of range. If it says the nurse should monitor for, you're looking for the most serious or life-threatening side effect, not the most common. The nurse should teach the patient too. With these types of questions, you're looking for patient education, safety, what they need to know when they are home. If it says before administering, the nurse should first, you're almost always assessing, getting a vital sign, checking a lab, confirming an allergy. Find the priority word and let it guide your answers. Step 3, when in doubt, pick the life-threatening option. This is the rule that saves students on side effect questions. NCLEX is not asking you what side effect happens most often. It's asking you what a nurse needs to watch out for most urgently. So if the question says, which side effect requires immediate nursing intervention, scan your choices for the one that could kill the patient or cause serious harm, not the uncomfortable one, not the annoying one, the dangerous one. For example, digoxin toxicity causes life-threatening arrhythmias. That's your answer over nausea. ACE inhibitors can cause angioedema, which is airway compromise. That's your answer over a dry cough. Lithium toxicity hits the neurological system, leading to tremors and confusion. That's your answer over thirst. Life-threatening every time. Let's put all these 3 steps together with a real question. A patient is prescribed lisinopril. Which finding should the nurse report to the physician immediately? Step 1, read the suffix, pril. So you know that anything that ends in pril is an ACE inhibitor. Step 2, find the priority word. The priority word in the question is report immediately. This means you're looking for something that is dangerous. Step 3, pick the life-threatening option. ACE inhibitors can cause hyperkalemia and angioedema. If your answer choices include swelling of the face or throat, that is angioedema. That is your answer. Airway compromise is always the priority. That's the strategy in action. Before we wrap up, here are 3 traps NCLEX sets on pharm questions and how to avoid them. Trap 1, they give you the generic name when you study the brand name, or vice versa. Metoprolol is Lopressor. Furosemide is Lasix. Acetaminophen is Tylenol. Know both names for the most common drugs. Trap 2. They ask what to monitor, and you pick the most common side effect instead of the most dangerous one. Always go life threatening. Trap 3. They ask about patient teaching, and you pick an action instead of what you will tell the patient. Teaching questions want education, not nursing interventions. Here's your quick reference list of the most tested suffixes on NCLEX. You have your OLOL. Those are the beta blockers. With these medications, you watch out for heart rate and blood pressure, and you never stop it abruptly. Then you have the sartan. These are similar to ACE inhibitors, but without the cough. Then we have those that end in azole. They're antifungals. With these medications, you want to focus on drug interactions. Then we have mycin. These are antibiotics. With these medications, you want to watch out for nephrotoxicity and ototoxicity. Then we have pril, or ACE inhibitors. These medications, we watch out for cough, hyperkalemia, and angioedema. Then we have the statins. Those are cholesterol medications. These medications, you watch out for the liver enzymes and muscle pain. Then we have the psyllin. They're antibiotics, penicillin specific antibiotics. You want to look out for allergic reactions. Then we have the medications that end in PAM or LAM. These are benzodiazepines. With benzos, you want to look out for respiratory depression and addiction. If you want all of this in one place, my pharmacology bundle is at katiecloset.etsy.com. It covers every body system: cardiac, respiratory, neuro, antibiotics, GI, and high alert medications. Everything organized by drug class with the key side effects, nursing consideration, and patient teaching you need. The link will be provided in the description. So, to sum it all up, 3 steps. That's all you need to know. Read the suffix, find the priority word, and pick the life threatening option. If this video was helpful for you, click the like button and subscribe for more nursing content. Go study smarter. You've got this.